Hi guys, Medicine with Sultana here. Today we will learn the infective inflammation of the upper respiratory tract in pathology. The inflammation of the upper respiratory tract can be divided into two types, acute and chronic, in which the acute is subdivided into 6 types. Rhinitis, which we commonly known as common cold, acute sinusitis, otitis media, acute pharyngitis, acute tonsillitis, and diphtheria. And the chronic has two subdivisions of adenoids and chronic specific infections of rhinoscleroma. We also have the allergic inflammation of the upper respiratory tract, in which we have allergic rhinitis and nasal polyp. Let us now discuss each of the inflammatory infections separately. Let us begin with acute rhinitis or common cold. Rhino means nose and itis means inflammation. Hence, common cold is the acute inflammation of the nose. Everyone, at least once in their lifetime, must have experienced common cold. So let us begin with the most simplest topic, which is the symptoms. Symptoms of common cold include watery discharge or runny nose with slight fever and nasal congestion. Pathogens of common cold are rhinovirus, which is the most important virus, and respiratory syncytial virus, parainfluenza virus, and influenza virus. The morphology of acute rhinitis includes acute catarrhal inflammation with excess mucus. The catarrhal inflammations are mild inflammations caused by weak pathogens such as viruses. During inflammation, we know that there is increase in vascular permeability, which in turn increases the blood flow of the mucosal vessels. This increase in blood flow is the reason for the excess mucus secretion. This acute rhinitis may lead to complication as catarrhal sinusitis, pharyngitis, and otitis media. Let us now understand the mechanism of acute rhinitis with the help of Ben. On the way to home, Ben saw a small boy in the park sneezing. At that time, Ben didn't realize that the rhinovirus from the boy's nose has entered Ben through aerosols, as rhinitis can spread by air droplets. After returning home, Ben starts to feel difficulty in breathing, runny nose, and increase in body temperature. Why does this occur? Let us now see what actually happened inside Ben when he was in the park. Because of the rhinovirus, now Ben's mucosal membrane undergoes catarrhal inflammation, in which the vascular permeability increases, leading to increase in blood flow to the mucosal vessels. Hence, now Ben has excess mucus secretion. This mucus must exit, so causing watery discharge from Ben, and swelling of mucosal membranes leading to nasal obstruction or nasal congestion. Let's not forget the fight between WBCs and rhinovirus causing a slight rise in temperature, which is the reason for Ben's suffering from fever. Thank you guys for watching the full video. I'm a fellow medical student trying to help medical students from all over the world to enjoy studying in an intriguing way. Visual learning helps students understand concepts easily as it stimulates images and affects their cognitive capabilities. In fact, research shows that we can process visuals much faster than text. So guys, if you want to watch more such videos, hit the like button, subscribe, and if you have any doubt, comment in the comment box.